Hi, I'm Dr. Castanet. I'm going to explain sciatica to you today and how best to treat it. I'm going to use a model for that purpose. This is a model of the lumbar spine or low back. These are vertebrae. Let me orient you. This would be the back of the person, so if you ran your finger down the midline of someone's spine, you could feel these hard bony processes. This would be the front of the spine, so the person's abdomen would be here. These are the vertebrae or bones. There are discs in between each of the vertebrae. These yellow things represent spinal nerves that exit from in between each of the vertebrae. If I turn this on end, you can see the top of the disc here. This disc doesn't show it, but discs are typically made of two basic structures. There are numerous rings that run around this way, around the circumference of the disc, that are very tough fibrous tissues. There are 12 to 25 layers of these. They're oriented at about a 30-degree angle from the horizontal, and they alternate so that one row will be this in this direction, the next will be oriented this way, and in aggregate that makes for a very tough fibrous connective tissue that holds in another component in the center that we call the nucleus. This material in the center of all of these rings that run around of tough fibrous tissue, the inner ring is more like the consistency of crab meat. It imbibes water and gets hydrated when you're non-weight bearing, such as at night when you're sleeping, and then when you're upright in the day, as axial loads from the weight of your body compress the disc, that central component distributes the loads to the fibers of the disc that contain it, and that's how the disc functions, both to absorb loads, such as when you're moving and lifting and being compressed with the normal activities in the course of a day, and that actually sort of squeezes out the fluid of the disc throughout the day, so the discs are a little bit less tall by the end of the day, and then you lay down and the inner material, which had imbibed water the previous night and is squeezed of the water during the course of the day's activities, then when you lay down can imbibe water again. The water and the nutrients to the disc at night come from the bones above and below that disc. The bones are very vascular, the disc is not. And so the nutrition and the fluids to the disc are provided by the great vasculature of the bones themselves. Over the course of a lifetime, as you can imagine, the physical demands on this cause some degeneration. That degeneration is a function of lots of things. It's a function of your nutritional status, the physical demands and loads on your spine, and your genetics. The activities that are more physically demanding, or the factors that are more physically demanding or result in quicker degeneration of the discs, include things like driving, heavy material handling, and we know that there's also a correlation between cigarette smoking and being a male, probably because being a male correlates with heavy physical material handling and driving, such as truck driving, etc. And smoking probably because smoking compromises all healing of all your tissues. So you are going to degenerate more from smoking than non-smoking. In any case, over a lifetime, these fibers can degenerate as they lose strength and integrity. The inner part can then, under load, be pushed out. This red lesion here is supposed to be a disc that's herniated, meaning that the inner material goes out through degenerative lesions or weaknesses of the disc wall here, And then when it does so and it migrates back that direction, it can hit the nerve roots, which are behind the disc. And if it does that, you will feel pain wherever this nerve root runs. The sciatic nerve is a nerve that starts in the buttock region. It's made up of 5 nerve roots in the lowermost part of the back and the sacral area, specifically the L4 through S3 nerve roots. Those nerve roots, like this, come together in the buttock, 5 on the right side, 5 on the left side. So there's a sciatic nerve on each side of your body that starts in the buttock region. And then as it descends throughout the buttock, the thigh, the leg, and the foot, it sends off branches to different muscles and tissues, skin, tendons, and other tissues throughout the lower extremity to serve the functions of your muscles and sensation and reflexes. And if the disc should herniate and touch one of the nerve roots, L4 through S3, that combine to make up the sciatic nerve, you will feel pain in the distribution of that particular nerve root. We know where these nerve roots generally innervate the skin and the lower extremity, including muscles, etc. So when we examine you, we take a history, we find out where you're experiencing your symptoms, and we do some exams to find out what reflexes or motor function or sensory pain you may experience. We correlate those findings with our knowledge of anatomy, determine which one of these nerve roots is likely affected. That tells us generally which disc is the problem. If we need to confirm that, we'll do an MRI scan to evaluate it and correlate the disc with the nerve. Oftentimes, however, we can forego the diagnostic imaging and treat the person on the assumption that it's a disc herniation, pinching a nerve, because these findings are very, very common, and they are benign even though they're very painful. So we don't always have to get diagnostic imaging. There may be times when we want to get imaging on the front end before doing treatment, but that's not always necessary. In any case, the best way to treat these kinds of lesions, which are by their nature compressive, is to decompress the spine. So if the spine is compressed and it results in a disc herniation that compresses the nerve root, the way I treat these, and I found this to be the most effective by far in my 34 years of practice, including 18 years in orthopedics, physical medicine, and physical therapy, as well as 5 years in a neurosurgical practice part-time, is to put the patient on a table. We call these tables spinally compression tables. They are just more sophisticated traction tables that we used to use decades ago that fell out of favor for a variety of reasons, including the fact that they were very crude tables at the time. Now they're very sophisticated, so we can place the person on the table, gently grasp their anatomy, gently pull these vertebrae apart to get pressure off of the disc. That encourages the discs to retract somewhat. It won't be very much, but it'll be enough typically to get pressure off of the nerve root and get you relief of your pain. It usually requires a series of treatments. Very rarely it will be as few as 1 treatment or 2 treatments. Also, very rarely it will be as many as 20 or 30 treatments, but that wouldn't happen unless the person was making progress throughout the course of the treatment and it just took more treatments to get them resolved of their complaint. More typically, it'll be something between 4 and 15 treatments, let's say, to improve your sciatic pain. It's also the best means of treatment for other complaints, such as just simple back pain or achiness of the back, exacerbations of pain, buttock pain. It doesn't always go all the way to the foot. Sciatica could go anywhere from, in its early course, just the buttock and thigh region, to its more severe course all the way down to the foot. In fact, the progression of sciatica often is from proximal to distal. We call that peripheralization, meaning that the pain will start often in the back, then as it gets worse into the buttock, and then into the thigh, and then further down the leg as the complaint or problem gets worse. And conversely, often during the course of improvement, the pain will retract or reverse in the opposite direction, leaving the foot first, then the leg, then the thigh, then the butt, until finally it's the back pain that is the last to be resolved. In any case, if I can help you with your sciatica complaint, please give me a call. I'm in Decatur, Georgia, 404-558-4015, and my name is Dr. Castanet. Thanks very much. Bye-bye.